When it comes to taking any medication, whether you're on one medication, 10 medications, or 30 medications, it's important to make sure you ask the provider or the prescriber questions about what's the medication for. I think sometimes when we talk about adherence, sometimes patients won't take a medication because they're not 100% sure what it's for. Another thing for patients to do is to have a conversation about, is this medication replacing another medication? And so, pharmacodynamics and kinetics, which is really just a fancy way of saying how medications are utilized and broken down in our body, are different in the elderly population. And so you might give a medication at a certain dose for the vast majority of the population, but in that elderly person or the elderly population, it might take longer. So rather than giving it every 24 hours, you should give it, every day and a half. Adherence, I think, is something we have to worry about in every patient population. It's not just in the elderly. Another one in the elderly population would certainly be cognitive. They might have some early onset dementia or some of those types of things, and so that might cause them to forget to take one of their medications. Another one would be the fact that they're on multiple drugs, and some have to be taken in the morning, some have to be taken with food, some have to be taken at bedtime, and we have to be careful of any dizziness and things like that to protect from falls. Hallucinations is another thing that we worry about with regard to adverse effects in the elderly population. Bleeding, there's a number of elderly patients who might be on antiplatelet or things like Coumadin, blood thinners. I think when it comes to adherence, some of the things that we can do, again, whether it's a provider or a pharmacist or whoever it might be, is think about dosing regimens, really try to focus on medications that only have to be taken one time a day. Medication therapy management, yep, and so they're able to sit down with the patient for what commonly is referred to sometimes as a brown bag session, where a patient will bring all their medications in a brown bag and they'll sit down with the pharmacist, and he or she is able to sit down and go through them with them and talk about, how often are you taking this medication? Do you have any side effects with this medication? One of the things I think is important is that you work with your pharmacy. I think it's important to go to one pharmacy on a regular basis so that they're aware of what medications you're taking and can look for drug interactions, watch your compliance, some of those types of things. It can also look for duplication of therapy.